Sciatica. Sciatica is one thing that can be very painful, has numerous sources. The one I'm going to cover today is the herniated disc. But there can be more problems with sciatica than discs. So it can be a piriformis muscle, a muscle that's in the gluteal region. It can be stenosis as a disc. Here's a normal disc right there. See that yellow? That's the nucleus. This outside rim is the annulus. And then we get degenerated disc. The bones squash down together, and where the nerve comes out, there's less room then. So that's stenosis. That can be a cause too. There can also be trochanteric bursitis can send pain down the leg. A sacroiliac joint problem can send pain down the leg. So there's different facet problem in the spine can send pain down the leg. So there's different causes of sciatica, but we're going to talk about that disc today. So the disc is right here. That's a herniated disc. So when you see normal, then herniated goes out, that nucleus goes out, puts pressure on the nerve. This is what it looks like from the side, and you can see that nerve where it exits, the nerve's in yellow, that disc is pushing on the nerve. So all we have to do is, when it comes to the disc, is get that disc slightly off the nerve, and we're gonna have success. So this is how we treat the herniated disc, and we have over 90% success rate. I think I've sent one out for surgery in the last 5 years, and we're a nutrition-based clinic, but we still see a lot of herniated discs because I've been doing this for 40 years. So here's the way we do this. Number one, let's look at the foods. Seed oils, sugar, refined carbohydrates weaken the disc, they weaken the body. That's not the things to be eating if you want to avoid herniated discs or if you have a herniated disc. So stay away from these. So here's how we treat it. Manipulation, we might or might not do manipulation with a herniated disc. It just depends. Flexion distraction will always do with a herniated disc. So that's the table that distracts, opens that up, can push the disc, start pushing the disc off the nerve. Myofascial release will always do with a herniated disc. Working the muscles because we want to work the joint, the muscle, and the ligament T-bar. So these, we use the T-bar to work the ligament. So right here, those three we're always going to do with a herniated disc. Now, we might throw in acupuncture if we got to control the pain, push the endorphins up, push the pain down. We might do that. We might do cupping, but we always do flexion, distraction, myofascial release, T-bar therapy on every herniated disc. So flexion distraction is not manipulation. Manipulation is different, chiropractic manipulation. So here's the thing that makes it different in what we do. Most people don't consider the nutritional component for the herniated disc. So calcium, you want calcium phosphate with a product that's got ground up disc in it from a cow. So that way we're getting disc to give nutrition to that disc. So manganese, not a synthetic manganese product over the counter, that's not going to do it. Food based, remember, food is your best medicine. So we use food concentrates, food supplements in order to do this. So I'm going to pick a product that has mostly manganese, but has other minerals that are going to help. Cola, that's the herb. So we always look at what's the vitamin, what's the mineral, what's the herb for everything, and what's the protein, and what's the action step. So Cola heals the scarring of the disc. It's a soft tissue healer. It's great. Taking Cola, good Cola, can actually cause your skin not to age as fast. Fish oil, always want to take that if you got a herniated disc. So by adding the nutritional component, we're strengthening that disc and we're causing it to do better. And with everything together, pull that disc off the nerve, give nutrition to that disc, and then once we get it fixed, stay on the proper nutrition. If some people don't want to take the nutrition, that's fine, but they won't. We have more of a chance of affecting that disc if we use the nutrition. Because like I said, I've been doing this 40 years, and so we've had a lot of experience with a herniated disc. So if you have a herniated disc, yes, it can be helped without surgery. Those few that need surgery. And when they do, I send them out. But most discs can be helped without surgery. So that's the herniated disc. Sciatica is a painful thing. So if you have any question about that, you can call our office, 314-843-9355. And I'll talk to you at any time, whether you're a patient or not. Till next time, guys, eat healthy, make it a great day.